stage. Good afternoon, everyone. This is microphone not on. Is there a button? Oh, there we go. Morning, afternoon. Everybody's getting settled, so I'll just take a minute to introduce myself. My name is Nancy Springman. I'm a resident here at Cedarfield, and I've lived here, my husband and I have lived here about a year, be a year next month. I am a practicing registered nurse for the last, embarrassing to say, 51 years, and worked the whole time. And I have extensive experience in nursing, but I have also taught nursing and have taught in continuing education classes. My focus has been for the last several years, I am a parish nurse at St. Mary's Catholic Church, and my focus has been primarily on wellness and health. So I've been working with Katrin. I don't know if you all have noticed, but I've had articles in the Informer, which I'm going to continue to write. And we're going to shoot to have some seminars like this one, maybe 2 or 3 times a year. So if you have any suggestions for me on some topics that you might be interested in, feel free to see me afterwards. I'll jot them down and put that on the list of things that people might be interested in hearing about. And I'm going to make a plug for our next program, which is going to be next month. It's going to be on Monday, September the 25th. I'm going to be doing a program about immunizations, the importance of immunizations for people over the age of 65. I'll be doing that in conjunction with Ann Hopper, who many of you know is the clinic nurse here, as well as another nurse who works there. Her name is Jean Macklin. She is the infection control nurse over in healthcare. And so we're going to be, because that's going to be right before it'll be time to get flu shots and COVID shots. So we're going to talk about those. So little plug, put it on your calendar. Monday the 25th. Eddie, where's my clicker to change my slides? Where'd he go? Thank you, sir. Oh, I can do it on here too. So today's program is going to be on osteoarthritis. There was a little confusion on the slides, and people thought it was on rheumatoid arthritis, but it's actually going to be about osteoarthritis. First of all, the question is, what is arthritis? Well, the term actually just refers to inflammation or swelling in one or more joints causing pain. It's interesting that we should all know that arthritis is not a single disease. There are actually more than 100 types of arthritis and related conditions in the medical genre. And some other examples of arthritis are things such as rheumatoid arthritis, psoriatic arthritis, gout. Many of you have heard of gout. That's actually a type of arthritis. Fibromyalgia, if you know what that is. People would never think that that's a type of arthritis, but under the medical literature, it comes under arthritis. Then there are other autoimmune diseases that arthritis is sort of part of the entire disease, such as a disease like lupus. People of all ages, races, and sexes live with arthritis. In this country, 58.5 million people over the age of 18 have some form of arthritis, and that's actually almost 25% of the US population. Believe it or not, arthritis is more common in women. It is one of the leading causes of disability in the United States. Half of all of those, half of everybody who has arthritis has limitations in their activities. Arthritis is not a disease of aging, Some people, even children, can have arthritis. There are several types of arthritis that children can get, and they have very long, complicated names. But one kind that you may have heard of is called juvenile rheumatoid arthritis. So not only adults have arthritis, but children can have it as well. What is osteoarthritis? That's what we're going to talk about today, and it's going to be abbreviated on the slides as OA. So we're going to focus today on this type of arthritis, which is the most common kind of arthritis in this country. It affects over 32.5 million people, and because the population of the country is aging, that number is going to go up over the years because more and more people are going to be developing osteoarthritis as the population ages. Some people call it degenerative joint disease, or sometimes you hear it called wear and tear arthritis. However, recent research has shown that there's also quite a bit of inflammatory response in these joints. So it's not, so there's inflammation in there as well as just wear and tear. So you've heard it, and we'll talk about this later, you heard the term bone on bone, and we'll show a picture of that later, especially in the knees, where the cartilage in the knees has completely deteriorated and there's nothing there to sort of cushion the bones. Osteoarthritis most frequently is seen in the hands, the lower back, the neck, and the weight-bearing joints such as your knees, your hips, and your feet. Unfortunately, there's no way to reverse osteoarthritis, but the symptoms can usually be managed with lifestyle changes and medication, which we are going to talk about today. What actually causes osteoarthritis? And this is an interesting picture. I don't have a pointer, but it's caused by damage or breakdown of the joint cartilage between the bones. And you can see from this picture that on the right-hand side, you can see that cartilage that's there on the end of that bone as it kind of lines up with the other, oh, on here? Oh, thank you. Oh, got it. Cool, all right. Oops, well, instead. All right, there we go. All right, so you can see from this picture here that this is the cushioning between the bones in your knees. If you have osteoarthritis, you can see there's loss of cartilage there, and again, then this joint space begins to narrow. Also, sometimes bone spurs can form there, and so we start getting what I talked about earlier, what some of your doctors might tell you, you have bone on your knee, and that's because all of your cartilage is gone. And I keep hitting the wrong button. These buttons are too close together. My arthritic fingers can't do it. Okay. What are some risk factors for developing osteoarthritis? The first one is being overweight or obese. This is a particular problem in your knee area. If you're overweight, it's putting more pressure on your knees. Also, too, people who have a problem with their weight also have a large degree of inflammatory response in their bodies. And therefore, I mentioned before that some of the latest research has shown that osteoarthritis has an inflammatory component to it. So if you have generalized inflammation in your body, it's going to increase your chances of developing osteoarthritis. Also, if you have diabetes or elevated cholesterol, it contributes to this inflammatory response. Other metabolic changes can affect your joint health at a cellular level. Also, women who have a decreased estrogen have increased knee osteoarthritis, and this is due to the lack of the protective effect of estrogen on bone health. So as women lose estrogen with age, it affects their bone health. Therefore, you've probably heard about the disease osteoporosis. As we lose estrogen in our bodies, that also can help aids in developing osteoporosis. Also, some other risk factors are histories of injury or surgery to a joint, overuse from repetitive movements of the joint, and also family history can have an impact on this. What are some of the common symptoms of osteoarthritis? And if many of you can relate to this, if you have it, pain and swelling in the joints, stiffness, difficulty moving or loss of flexibility, tenderness, and sometimes warm to the touch. This is particularly true if you start, and we'll talk about this later, when your joints swell, especially in the knees, if you have fluid around the knees. That can also sometimes make the joints warm to the touch. How is the osteoarthritis diagnosed? If you start having problems with your joints and you go to see your healthcare provider, some of the things that person will do is ask about your symptoms, your family history, and obviously your general medical history. Again, as I mentioned before, if you have a history of diabetes or elevated cholesterol, that might have an impact on your developing osteoarthritis. Obviously, the provider will do a physical examination. They may use x-rays or ultrasound or MRIs to diagnose the problem. They might order some laboratory tests, again, as these joint problems can be related to other systemic diseases. As I mentioned before, a disease such as lupus, there may be more going on in your body other than just the problem in the joints. So your joint problems may not be just osteoarthritis. They could be a component of some other type of a disease. And as I mentioned before, sometimes the joint will swell, particularly in the knees, and they'll get fluid on the joint. Well, sometimes the doctor will aspirate or take out that fluid and analyze that in a laboratory to see what is the component of the fluid that was on the knee. The goals of treating osteoarthritis are threefold. It's to decrease pain and stiffness and delay the further progression of the disease. It's to improve mobility and function, and also to increase the quality of life. I mentioned earlier that osteoarthritis and any form of arthritis really contributes to disability claims in this country. And so if we can increase the quality of life, that's a really good thing. So, how can we treat osteoarthritis? Well, there's several things we can do. We can take oral medications, and some of the medications that are used are acetaminophen, which is Tylenol, a group of medications that are called NSAIDs. They're things like Motrin, which is also known as ibuprofen. There's another drug called Aleve, also called naproxen sodium. Obviously, those are medications that can be purchased over the counter. Also, there are NSAIDs that your doctor can prescribe for you. You might have heard of some drugs called Mobic or Celebrex. Those are NSAIDs that your doctor can prescribe. And there's also a drug called Cymbalta, which was developed to be used as a drug to treat depression. But they found that it has shown some benefit in of treating arthritis pain as well. There are topical things that you can use to help the pain in your joints, and some examples that I just put a few examples up here. Voltaren, which is an NSAID, but it's a cream, if you will, that you can rub into the joints. It used to be by prescription only, but the last few years it's available over the counter. It's particularly useful with knee pain. There's some other drugs called, these are all over-the-counter drugs. Capsaicin, Bengay, Icy Hot, Aspercreme, Biofreeze. These are all things that can be purchased over the counter. Sometimes you have to try several of them to find one that really works for you. But they are very helpful, and certainly better than, if you can get by with using a topical, it's much better than having to take actual pain pills or pain medication orally. Also, other topicals include patches. And you've probably seen this advertised on TV, something called a salon pass. It's a patch that you just put over the joint that's hurting. They can be purchased over the counter, and there's also ones that can be purchased, that can be gotten by prescription. The one that I happen to have a picture of up there, it's called a lidocaine 4% patch. I believe you used to have a prescription for that, and there may be higher levels that you do need to have a prescription for, but when I was reading up on this, Salonpas and some of the other over-the-counter drugs say on their label that they contain 4% lidocaine. So it may be something that you could buy over the counter, and perhaps if you got a prescription, it would be a higher level of lidocaine, and lidocaine is a local anesthetic. So, you can manage and treat osteoarthritis, as I mentioned, with a variety of medications, but there's some other lifestyle changes that you can incorporate that will help in your treatment of the arthritis. First is weight loss, and this is a very interesting statistic. If you lose 1 pound, it takes 4 pounds of weight off your knee. If you lose 5 pounds, which isn't very much and wouldn't be that hard to do, it will take 20 pounds of pressure off your knees. So if you suffer from arthritis in your knees and you have a weight problem, a small amount of weight loss would really, really help your knees. Here at Cedarfield, we have a dietitian who is here. Now, she's primarily over the licensed areas. She works with them primarily, but she told me that she would be happy to consult with people if they have diet questions. You just have to make an appointment to go see her. The next thing is diet, and I'm looking out into the audience, and prior to this talk, about a week ago, a resident came up to me and said, "Are you going to talk about diet and food as it relates to arthritis?" And I said, "Yeah, what do you want me to talk about?" And she said that she had read online about certain foods you're not supposed to eat if you have osteoarthritis. Now, I'll back up and say there are dietary restrictions if you have gout, but so based on her question, I did a deep dive into this. And I cannot find anything online that shows that any kind of a special diet will help this, or any kind of foods, or are there any foods you should avoid. All I have read was that you just need to eat, as we always talk about, a healthy diet that just has plenty of fruits and vegetables, lean meats, healthy fats, the normal things that you hear about all the time. So I hope that answers the question on that. And I asked her, I said, how did that question come up? And she said, well, one time I was online and I was reading about something, and as we well know, on the sides things pop up, and she clicked on some stuff, and then she said, I figured it was some kind of a bogus thing because then later on they wanted you to buy stuff. And I said, that's usually a pretty good indication. And just as an aside, as a nurse, if you want to read up on any kind of medical condition that you might have, please just stick with legitimate sources online, such as well-known places like the Mayo Clinic, the Cleveland Clinic, a website called WebMD. Obviously the government sources, the CDC, the NIH, the National Institutes of Health. Stick with those. Don't go wandering off into the world of who knows what out there, because you can not get the proper information that way. So in addition to weight loss and diet, there are some other things which McKenna is going to talk about, which is exercise, physical therapy, supportive devices, hot and cold therapies, and complementary therapies. The other speaker today is going to focus on those sorts of things. In addition to oral medications and patches, you can also get injections into the joints to treat osteoarthritis, and some of you may have had these. Some of the things that are used in the joints are cortisone, also known as a steroid, and if that's injected into the joint, it decreases inflammation and hopefully will give you some temporary relief to the pain. There's something called hyaluronic acid that can be injected into the knee. It mimics the normal cushioning fluid in the joint, and so again, takes some of that pressure off that bone-on-bone problem. There are things called prolotherapy. which is a concentrated form of dextrose. Dextrose is sugar that can be injected into the knee. And I might note, for what I read about that, it's not covered by insurance. And the last area is sort of an area that's being looked into, but people, there are physicians that are using this. It's called orthobiologics. And I might just point out to you, they're not FDA approved and they're not covered by insurance. So technically they're sort of, if it's not a clinical trial, I would caution about going into this realm of treatment. And one of the ones that people are talking about is something called PRP, platelet-rich plasma. And what they do is they draw your blood, they pull out the platelets, which are actually the cells that clot your blood, and they then inject those right back into your joints. There has been some indication in the literature that there's some help there's been some improvement in people by having PRP injections, but again, it should be done in the course of a clinical trial, a research project, but there are physicians out there who are using this to treat osteoarthritis. Okay, if osteoarthritis pain cannot be managed with conservative treatments, surgery may be an option. And all of you have heard about joint replacements. And it seems like in medicine today, they can replace just about anything. They can do ankle replacements, shoulder replacements, knees, hips, you name it these days, they're replacing it. So, as I mentioned, there are numerous procedures that can be employed depending on the joint involved that can be replaced. I'm not going to go into a lot of detail about this today, but I would just caution you that these conservative treatments that we've talked about, that you start doing early on when you start having pain in the joints, can really keep you away from having this surgery. And as a personal example, I've had a bad knee since I was in my 20s. And I consistently do exercises, proper exercises, weight-bearing exercise, other types of exercise. A little plug for McKenna when she comes up here about the importance of that. And yeah, I have trouble with it every once in a while, but it's nothing that I have to take medication for or anything like that. I might have to wrap it with an ACE wrap once in a while if it swells, but it's pretty much not a problem. And so if you do the things that I talked about, making lifestyle changes, it can really help with osteoarthritis. And in conclusion, I would like to put one saying up there, which McKenna loves this saying too, and she's going to talk about it in her talk. And it is, motion is the lotion. Meaning, get up and move. And I can tell an anecdotal story about a friend of mine who was having all these knee problems, and she went to go see an orthopedic surgeon, and he did his evaluation, and they were sitting there talking, and he told her, this is the exact words he said to her, motion is the lotion, and excuse my French, get off your butt. That's exactly what he told her. Get off your butt and start walking. Well, she was able to keep from having her knee replaced for 2 years by doing that. And getting regular exercise. She didn't need to lose weight, but just to get on an exercise program. So that, in conclusion, as introduction to McKenna, thank you for your attention today. We will take, if you have any questions, we gave you a handout on the way in. Jot down your questions, and McKenna and I will be available to answer them afterwards. Thank you.
All right. Thank you, Nancy. So I will introduce myself. I see a couple of familiar faces, but my name is McKenna Weeks, and I am the current rehab director here at Cedarfield with Health Pro Heritage. I'm an occupational therapist by background, and while Nancy talked a little bit about the medical side of osteoarthritis, I'm going to be talking about how therapy can help you manage some of the symptoms and side effects that are associated with it. So what are the goals of therapy with something like osteoarthritis, and what does the plan of care look like? We're really looking at maximizing your overall mobility, right? So we're wanting to maintain joint mobility and flexibility, so we may work on things like range of motion. We may do that passively, you know, us doing most of the bending, if you will, for you. Or we may do something called active assist range of motion, where we are assisting with the flexibility, but you are also engaging the muscles as well. Another goal is to prevent joint deformity, to maintain or improve your strength, maintain or improve ability to perform your everyday tasks, so the things that you want and need to do on a daily basis. We would like to decrease your pain through various techniques and modalities that we will touch on later. We want to develop a plan for you for balancing activity with rest. So again, we want to stay active, and we're going to talk about how exercise can be beneficial for joint pain and osteoarthritis, but we don't want to overdo it. And then we also, as therapists, we develop problem-solving skills with you to modify your daily activities to help you protect your joints. So exercise as a therapeutic intervention. It's easy to avoid exercise and movement in general if you're in pain. But it is in fact one of the best treatments, conservative approaches for osteoarthritis. As Nancy mentioned, I love the term or the phrase, you know, motion is lotion, or motion is the lotion, because we have what's called synovial fluid that's in our joints. And when we move these joints on a regular basis, it helps to lubricate them, which results in increased flexibility as well as decreased pain. Another one that I threw in there just for fun, rest is rust. So of course, if you're resting and not moving those joints to get them nice and lubricated, then they may rust, if you will. Exercise can also improve your mood and outlook. It can, again, increase your flexibility and help you to maintain a healthy weight. And as Nancy mentioned, weight loss is one of the contributing factors, you know, that can help you manage this type of diagnosis. Exercising can also help to break the cycle that we call, you know, it's pain, weakness, and joint degeneration that is associated with arthritis. So you start with the pain and the swelling, and then that can turn into weakness due to immobility, and you know, that can be associated with fear. You know, a lot of people, they want to guard and protect their joints. You know, if it's going to move, who wants to do that, right? And then that can then lead to cartilage degeneration. So some exercises that we may look at in therapy are low impact aerobic exercises that will help you to build your endurance, range of motion exercises for flexibility and to lessen the risk for permanent contractures, and then also strength training, which improves muscle tone and can help support the muscles surrounding these larger joints, such as the hips and the knees, thus providing increased joint stability. We'll go into this a little bit more in detail later as well. So aquatic exercises can allow us to exercise without causing so much stress on our joints. So we call these low impact activities. Aquatic exercises are a great example of this, and we have these right here at Cedar Field. Working in the water can help to lessen the gravity forces on the joints. And also, if there is heated water, that can help to relax the muscles and allow for improved range of motion as well. So this is a little visual that kind of encompasses the whole body. So while strength and aerobic exercise are both important, we also want to target or recognize the mind and the body as well. So if you look at the top blue triangle, it mentions Tai Chi and Yoga. These are both gentle ways that for people who may have some fear associated with movement. So as I mentioned earlier, if you're anticipating that it's going to hurt, Tai Chi and Yoga may be a good introduction for you to get some of these joints moving. So a lot of times as therapists we hear, okay, well, I understand that you want me to exercise and move, but how much? And really the amount and the form of exercise will depend on a number of different factors, such as which joints are involved. Is it your hip that's primarily involved? Is it your knee? Is it your shoulder, or even your wrist and the small joints that are in your fingers? It will depend on the stability of the joint, whether or not it's currently swollen or not, and also if a joint replacement surgery has already been completed or not. Therapists will also help you to develop an individualized exercise program, which will incorporate the best exercise for you. So we have expertise in really looking at your medical history, any previous surgeries that you may have had, and kind of look at you in a larger picture so that we can really tailor the different exercises and the plan of care to you so that you may benefit the best from it. So now I'm going to talk about something called joint protection strategies, and these are just a series of techniques which can be included in all activities to help you reduce the stress that is on your joints. So joints that have been weakened by arthritis are at particular risk of being damaged by repetitive use and stress and strain. So physical and occupational therapists will actually look and assess at how you're doing various tasks at the moment, and then how they may be contributing to joint stress, and then also provide recommendations for how to complete these tasks in a safer way that will help you to protect and prolong the life of those joints. So a couple of examples of joint protection strategies are to avoid a tight grasp. You want to avoid repetitive activities. You want to reduce periods of immobility. You want to use good body mechanics and good posture. And you also want to use your larger joints. So for example, you see up on the screen there's a photo of someone holding a bag. So he has it up on the shoulder versus carrying it in his hand. So you're really relying on the more proximal, stronger and larger joint to carry the weight versus the smaller joints that are in your fingers and hands. So therapy's role in pain management. Pain is often the most common symptom or side effect that we hear associated with osteoarthritis. And it can be a major limiting factor throughout your day-to-day activities, you know, when you do have pain associated with arthritis. So we can assist with reducing pain in a number of different ways. First is through joint and tissue mobilizations. So we will look to make sure that the proper alignment of your joints is intact, reducing pressure on sensitive structures, improving your flexibility and blood flow, and also reducing muscle tension. We also may treat pain through moist heat, or hot packs as we call them, or cold packs. This will help to cause what we call vasodilation of the blood vessels, which can then increase the circulation to that area and reduce the inflammation. And then lastly, I have a photo in the bottom corner of a TENS unit, which is just a non-invasive nerve stimulation device that is intended to reduce pain. A lot of times, you know, these are very portable. People will carry them throughout their day-to-day and do treatments throughout the day, or it may just be something that you use for a short time in therapy. A number of different supportive devices or splints can be used to help protect and support our joints. So they're typically worn during periods of time when the joint hurts. Some are provided strictly for support, and others are provided to help align the joint and keep it in a more neutral position. And again, everybody's situation is different, so therapists are trained, you know, to assess your individual situation and provide recommendations for what is best for you. So here's a couple of photos of different adaptive equipment, and this is the fun stuff for me, because as an occupational therapist, these are the types of recommendations that we will make to different individuals to help make daily tasks a little bit easier. So in the bottom right or bottom left corner, you can see a device that someone is helping to open a can. The one beside it is just used to open tight jars. And then moving forward, you see some what we call built-up grips or handles on eating utensils. Beside that is what we call a rocker knife, which is just a one-handed technique that you can use to cut up different foods. And then these tubes on the bottom right corner, we call that tubey grip. And I love this in particular because it comes in 3 different sizes, and you can use them to go on your typical devices that you use throughout your day-to-day already. For example, your toothbrush, your hairbrush, your favorite pen, you know, your normal eating utensils, and this will really provide a larger grip for your hand, making the task easier. And then the one in the very top is something that we could all use. I could use one of these. It's a handle that you just put your grocery bags on, and instead of loading them all up on your arm, it provides you a better support. This is just a couple of examples of adaptive devices. Again, a therapist can really look at your situation, what daily activities that you're finding more difficult, and come up with ways and different devices to help you in particular. So it has been proven that people who take an active role in the treatment of their arthritis tend to have better quality of life, reduce their sense of suffering, and to feel more empowered. So these are just 8 strategies or self-management tips that you can follow to help you kind of take control of your arthritis. So number 1, being organized. 2, managing pain, but also respecting your pain. It will be there, but if you're having, 10 out of 10 pain, probably not a good idea to keep moving forward with that activity. So there's a good balance there, and you really want to pay attention to it. You want to address emotions. You may be experiencing anger or frustration if you're no longer able to do any or one of the activities that you really enjoyed doing previous before you had something like osteoarthritis. You want to reduce stress, tackle fatigue, and improve sleep. You want to stay moving, again, through either just a regular exercise routine or through physical therapy. You want to balance your activity with rest. You really want to pace yourself. You want to eat a balanced diet and lose weight, and also protect those joints. So here are some examples of fitness classes that we have available to us right here at Cedarfield. We've got the Cedarfield Walking Club, which takes place outside. We've got indoor walking groups, gentle yoga, massage therapy, sit and get fit. And then the last four I have that are italicized are water aerobics, water Zumba, bar, and Tai Chi. And I've italicized these last four and pointed them out because they are examples of low impact exercises. So those types of movement and exercises that we can still participate in while reducing the stress on the joints. For more information about the schedule of these classes, you can check the calendar that's in the monthly Informer, or you can also stop by the group exercise studio, and there's usually a weekly calendar printed right there as well. And then a couple of just additional resources. The Arthritis Foundation has a ton of resources on their website. They've got exercise videos that you can follow along with, and they're really targeted to each joint. They're great at explaining, going into detail on how to do each movement. And then there's also Silver Sneakers, which is available at no cost with some select Medicare plans. You would have to contact, your insurance to verify. But the Silver Sneakers website, they have online courses as well, and they also have a number of different in-person sites in the Richmond area. All you have to do is go on and type in the zip code, and it will come up all of the different locations that are right here central to us that you can participate in. All right. Next, we're going to go through a little bit of an exercise demo with Vlad, one of our physical therapists, and then after this, we will have time to take some questions.
Hello everybody, I'm Vlad. I know most of you. So a couple things I was just going to talk on with physical therapy. A lot of what we're looking at is alignment. It's how we're moving. That's what's really important when we talk about arthritis. A lot of times the analogy I like to give people is kind of just like your car. When you get new tires, you have to get alignment done. People get joint replacements. It's very important to have the proper alignment. Sometimes we start to learn different compensatory strategies, ways that we start to move in order to deal with the pain, and that doesn't necessarily change back when people get joint replacements. So watching how a person walks, how they move, in particular things like getting up from a chair, it really makes a big difference on the alignment of the joints. And so this holds true for before surgery and after surgery. So something as simple as getting up and sitting down from a chair. What we see a lot of times, because of strength deficits, let me know if you can't hear me, I'll try to speak up. With strength deficits, sometimes what we see is that the knees will go inward like that as a person's getting up. We don't keep that nice alignment of keeping the hips over the knees, over the feet. which is important. That involves a little bit more strength in particular muscles like the gluteal muscles. Oh, thank you. In muscles such as the gluteal muscles back here. A lot of times what happens is that people are compensating with the muscles in the front of the thigh, and they tend to brace the two legs together as they're going to stand up. That puts the knee in a very awkward alignment. If you try to picture that, bending inward like that, you have a high pressure area over a very small area. If you're in a proper alignment, that same pressure is spread over a greater surface area. So that's going to be healthier for the cartilage that's left in the joint. So if we are more cognizant of how we're moving as we get older, it helps prolong our joints. And that's where physical therapy a lot of times comes in. So looking at which muscles are really weak, where there's deficits, and a lot of times it's in the proximal hip muscles. So something as simple as an exercise of practicing standing up and sitting back down from a chair. And a lot of times for some folks, it means starting from a higher surface. A lot of folks, your beds are a little bit higher, so that's a great place to start. You want to start from a height where you can really keep the knees over the feet, okay? You don't want the knees to go to the inside, and just practice standing up and sitting back down. You'll see that a lot of times we become over-reliant on our arms in order to push ourselves up, and that alters our normal body mechanics when we go to get up. So you see a lot of folks doing this and using their arms a lot instead of using the glutes. So practicing from a higher point, like your bed, of just standing up and sitting back down is a great exercise. The other thing that we start to limit is in some range of motion, particularly like the hip extension. So a nice staggered stance, stretch, putting one foot forward, keeping your pelvis kind of posteriorly tilted so your back is straight, and just going forward so you feel a little bit of a stretch. I'll do it sideways here so you all can see. Coming forward so you feel the stretch in the calf muscle as well as the hip flexor. These are muscles that a lot of times tend to get tighter as we get older and put more stress on our joints. If my hip flexors are tighter, it's going to limit my step length. And a lot of times we'll also go into a compensatory trunk flexion as I'm stepping. And that's going to put greater force on my knee. If I bend forward like this, it puts a greater force on my knee that can further break down of the cartilage. So the more that I can keep good upright posture, maintain good posture, it normalizes the joint pressures in my joints and helps to prolong them. The other thing that we talked about was walking. That walking, the rhythmic loading and unloading of joints is what stimulates health and what's left of the cartilage. And that's one of the reasons why doctors will always tell you the best thing you can do for yourself is increase your walking. A lot of our cartilage doesn't have direct blood supply. It relies on nutrients that are absorbed through the synovial fluid. It will only absorb those if it's progressively loaded and unloaded. So as I step on my joint, it wrings out some of the fluid. As I come up and offload the joint, it sucks up some of the fluid. And that's where it gets a lot of its nutrients. So one of the biggest problems as we get older isn't the aging itself, it's not moving. As we stop moving, our bodies break down. Just like an automobile, if you park a car for 6 to 8 months out in the parking lot, tires are going to start to dry rot, batteries are going to start to die. We have to move, we have to keep moving, and we have to be cognizant of how we're moving. As we get older, it's very important to move with more knowledge behind it. We have to be careful how we move. We can't be as reckless as we were when we were younger. When we were younger, we had all that beautiful cartilage over the ends of our joints that protected those joints. Now we have to be a little bit more mindful in how we move. Sometimes in PT, that's where it comes in, where we also will suggest assisted device. You had mentioned about how losing 4 pounds would take, I think 1 pound was 4 pounds off the knees, right? So when I stand like this, right, if my hip is allowed to give like that, it will increase the amount of weight through my I think, threefold. Something as simple as a cane out here that keeps me level and keeps the abductor able to maintain my hips level across will decrease it back to 1 times body weight. So the more that I can maintain my hips level across, a lot of times you'll see folks walking down the hall and their hip drops with each step. that puts a very excessive amount of force at the hip and at the knee. So again, things that we can do in PT to address that, to try and make you more aware of how you're moving over your joints, can really go a long way in helping with offload your joints some. The other big one, piggybacking off of what I just said, is the hip abductors tend to be another area of great weakness in a lot of folks. We do a lot of motion, a lot of times going forward. As we get older, we're not doing as much as raking leaves, we're not doing as much sweeping floors, we're not doing lateral motions as much. And that becomes very important. Just like in sports, you hear about cross training. Well, when we get older, cross training is still very important. We have to get lateral motions to maintain strength in the proximal hip muscles. So something as simple as doing resisted sidestepping can be incredibly important in maintaining the strength in those hips. And that can carry over to walking in a way that's going to offload your joints a little bit more. Any questions? So with stretches, I kind of alluded to the staggered stance stretch. I think is a really good stretch. Stretches, we usually recommend that you hold for a minimum of 20 to 30 seconds. And you have to do stretches at least 4 times. And if you skip more than 2 days in a row of stretching a muscle, it will revert and tighten back up. So you want to make sure that you're stretching daily. Yes?
To use the Cedarfield physical therapy group that you're part of, do you need a prescription?
Yes.
What was the question?
Do you need a prescription to access physical therapy or occupational therapy? And the answer is yes. We need a referral from a physician. So the general process is the doctor will write a prescription, and then we'll set an insurance verification, and then we'll contact you once we get the insurance verification back, so that way we can let you know ahead of time if there's out-of-pocket expense. Medicare usually covers 80%, but with some of the Medicare replacement policies, that's not always the same, and there may be limitation on visits with secondary insurance policies as well. Other questions?
I don't have a question, but already one of the audience members commented to me about the lidocaine patches and lidocaine creams that I referred to. I love the internet. While McKenna was talking, I did a quick search. And as I mentioned, there are lidocaine patches, but there's also lidocaine creams. The lidocaine creams and the patches are about 4% over the counter. There looked like there were some that were 5%, especially the creams, not the patches. Those used to require prescriptions, but it looked like they don't anymore. And also, the audience members said something about that they had used a patch for shingles one time. And he thought that was the only approved use for those. But there are clinical trials, there are articles in the medical literature that have shown that the lidocaine patches and the lidocaine cream are useful for osteoarthritis. Most of them seem to be knee related, that I could see on a quick, just looking on my phone real quick. But I know people, and I know at the clinic I used to work at, our physicians would prescribe, at that time, the lidocaine patches required a prescription for back issues as well. I don't know if it was necessarily for back arthritis, but so many times when you have back problems, it is related to some arthritic issue. So that was what I found when I was looking online on that issue.
Another thing I'll just kind of add, along with some of the things I was saying before, another thing is that with arthritis, the less that we move, the less that our body produces synovial fluid into the joint. So a lot of times the other thing to think about is that before we get up and load, put our body weight that's compressing the joints together, something as simple as doing joint motions, kicking out, moving your ankles, helps to get joint fluid in there that helps to lubricate the joint before you stand up. A lot of folks with arthritis will probably tell you that a lot of times it's the first bit of getting up and walking across the room is the hardest. And that's because that's when that joint fluid is trying to work its way into the joint space. If you do some simple motion before you stand up, a lot of times that can make those first couple of steps a lot easier because you get some of that fluid in there. It's just like warming up your car on a cold winter's day.
All right, well, thank you, Nancy, McKenna, and Vlad for presenting this afternoon. We appreciate it.